Seizure disorders constitute the second most important category of neurologic disorders following stroke. Currently, 2.5 million people in the United States have a seizure disorder. These seizure disorders may accompany many neurodegenerative conditions or a traumatic brain injury, or may occur in isolation. Contrary to popular belief, most seizures do not cause convulsions. A seizure is a period of sudden, excessive activity of the neurons in the brain and frequently results in loss of or a change in consciousness, but not necessarily convulsions, which may make them more difficult to recognize. Historically, seizures, especially in the more violent ones, were considered God's punishment, work of demons, or a sign of demonic possession. Seizures have been used to identify those who practice witchcraft as well. Although the ancient Greek physician Hippocrates hypothesized that seizure disorders were biological in nature and were not divine, in the latter part of the 19th century was when John Hewlings Jackson and his other English colleagues began to study epilepsy and recognize it as a seizure disorder. The symptoms of a seizure disorder will vary greatly based on the focal site of activity. Seizure disorders are broken down into two main categories: partial and generalized. Generalized epileptic seizures start on both sides of the brain at once. Many people with generalized seizures have a genetic or hereditary cause underlying their epilepsy. Types of generalized seizures include absence seizures, tonic-clonic seizures, myoclonic seizures, and atonic seizures. Partial or focal seizures start in one part of the brain, which is considered the focal point in the brain, and affect that part of the body controlled by the part of the brain. Partial seizures can be further broken down into simple and complex. Partial seizures begin at a focus and remain localized, meaning they do not generalize to the rest of the brain. Simple partial epileptic seizures are confined to a small part of the brain. During partial seizures, individuals have normal awareness of their surroundings. The individual may experience the jerk of an arm or a hand or other symptoms that correspond to the part of the brain having the seizure. Complex partial epileptic seizures are confined to a particular region, but have spread enough that individuals have an impaired level of awareness about their surroundings. This seizure is common, particularly involving the temporal lobe. Individuals having complex partial seizures may exhibit the following symptoms: a glassy stare, lack of response, inappropriate or confused response to questions, sitting, standing, or walking aimlessly, lip smacking or chewing motions, unusual vocal sounds, and fidgeting. Partial seizures with secondary generalizations are focal seizures that spread to both sides of the brain, causing a grand mal convulsion. Except for beginning locally and spreading, partial seizures look at the same as generalized tonic-clonic seizures, as described. Many families describe a complex partial seizure as the patient's small seizure and the convulsions that result from secondary generalization as big seizures. As a clinician, we want to know the area of the brain that is being affected by an individual's epilepsy. This will help in treating and assessing our patients. Temporal lobe epilepsy is the most common seizure disorder in adults. Persistent seizures can damage the hippocampus. The hippocampus is responsible for learning and memory. Often, surgical intervention is needed to manage temporal lobe epilepsy. Cerebellar epilepsy involves cerebellar damage, which causes seizures, and is typically seen in conjunction with fetal alcohol syndrome. A child's cerebellum either fails to develop properly or is damaged in utero through the mother's continued use of alcohol. Frontal lobe epilepsy involves seizures which often occur when an individual is sleeping. These may look like psychiatric problems or a sleep disorder. Because of the symptoms that accompany frontal lobe epilepsy, like inattention, fatigue, and difficulty with executive functioning, frontal lobe epilepsy can often be difficult to recognize. Status epilepticus is a condition in which a patient undergoes a series of seizures without regaining consciousness. It frequently causes significant hippocampal damage due to the excessive release of glutamate and a neurotransmitter important for learning and memory. Multiple episodes of status epilepticus can be seen for cognitive impairment if the seizure disorder cannot be managed. Photosensitive epilepsy is a much more publicized seizure disorder. This is a courtesy of a rash of episodes in Japan following a cartoon in which flashing lights triggered seizure disorders. In this case, the brain fails to habituate a repetitive stimuli, which therefore induces a seizure. Unlike partial seizures, generalized seizures are more widespread and involve most of the brain. This abnormal neuronal activity may travel across the corpus callosum and cause both hemispheres of the cerebrum to experience damage. Listed in the chart are several generalized seizure disorders and their following symptoms. Absent seizures are also known as petit mal seizures. These types of seizures involve a sudden lapse of consciousness and may go unnoticed, especially in children who may not remember the seizure or the period of inattention that follows it. Absent seizures can be misattributed to fatigue, head injury, or attention deficit hyperactivity disorder. Despite the unremarkable nature of the seizure itself, absent seizures can still be incredibly dangerous since they are still a type of generalized seizure. The amount of danger may depend on a situation in which the seizure is likely to occur, for instance, in driving or swimming. Atonic seizures are a generalized seizure where the patient experiences temporary paralysis with a loss of muscle tone. Atonic seizures are also referred to as drop attacks. Atonic seizures involve muscles suddenly losing strength. For instance, an individual's eyelids may droop, their head may nod, they may drop things, and often fall to the ground. The person usually remains conscious, and these seizures typically last less than 15 seconds. Atonic seizures often start in childhood and last until adulthood. Many people with atonic seizures are injured when they fall, so they may also choose to use protection such as a helmet. Patients who have this type of seizure may have one or several in a row. When an atonic seizure occurs, make sure the person is in a safe place to prevent injuries from fall. Tonic-clonic seizures are another type of generalized seizure. These seizures involve a complete loss of consciousness and violent muscle contractions. This type is what most people think of when they hear the word seizure. An older term for them is grand mal. As implied in the name, they combine the characteristics of tonic seizures and clonic seizures. They are divided into two phases. The tonic phase comes first. All the muscles stiffen. Air is being forced past the vocal folds, causing a cry or a groan. The person loses consciousness and falls to the floor. The tongue or cheek may be bitten, so bloody saliva may come from the mouth. The person may also turn a bit blue in the face. After the tonic phase comes the clonic phase. The arms and legs are usually being jerked rapidly and rhythmically, bending and relaxing at the elbows, hips, and knees. After a few minutes, the jerking slows and stops. Bladder or bowel control sometimes is lost as the body relaxes. Consciousness returns slowly, and the person may be drowsy, confused, agitated, or depressed. These seizures usually last 1 to 3 minutes. A tonic-clonic seizure that lasts longer than 5 minutes needs medical help. A seizure that lasts more than 10 minutes or 3 minutes per seizure without a normal period in between indicates a dangerous condition called convulsive status epilepticus. This requires emergency treatment. The typical appearance of tonic-clonic seizures is usually easy to recognize. The doctor will want a detailed description of the seizures. An EEG or other tests may help confirm the diagnosis or suggest a cause. Febrile seizures are convulsions brought on by a fever in infants or small children. During this type of seizure, a child will lose consciousness and shake, moving their limbs on both sides of their body. Less commonly, the child may become rigid or have twitches in only a portion of the body, such as an arm, leg, or on the right or left side only. Most seizures last a minute or two, although some can be as brief as a few seconds, while others last more than 15 minutes. The majority of children affected by this type of seizure will have a temperature greater than 102 degrees Fahrenheit. Most febrile seizures occur during the first day of the child's fever. Children prone to this type of seizure are not considered to have epilepsy, since epilepsy is characterized by recurrent seizures that have not been triggered by a fever. Although they can be frightening to parents, the vast majority of febrile seizures are short and harmless. During a seizure, there is a small chance that the child may be injured by falling or may choke from food or saliva in the mouth. Using proper first aid for seizures, this can help to be avoided. There is no evidence that short febrile seizures can cause brain damage. Large studies have found that children with febrile seizures have normal school achievement and perform well on all intellectual tests as their siblings who don't have seizures. Even when seizures are very long, most children recover completely, but a few might be at risk for subsequent seizures without fever. Now that we've discussed the various classifications of seizures, you may be asking yourself, what is a seizure? A seizure is a dyssynchrony of the brain's electrical activity. It is hypothesized that this dyssynchrony occurs from loss of inhibition and habituation. For example, in the case of strobe lights, this repeated maximal response loop can trigger a seizure. There is a failure to habituate a sensory response, which will trigger a maximal response each time. Additionally, it appears that decreased GABA, an inhibitory neurotransmitter, plays a role in seizure disorders. Without this inhibitory role of GABA, whether the deficit is caused by faulty receptor functioning or an overall decrease of GABA in the brain, excitatory neurotransmitters can fuel overactivity of neurons, generating a seizure. There may be a variety of signs and symptoms that a person may experience during a seizure. Seizures can take on many different forms and affect people in many different ways. Seizures have a beginning, middle, and end. Not all parts of a seizure may be visible or easy to separate from each other. Before a seizure happens, individuals may experience déjà vu, changes in smell, sound, and taste, vision loss, panic or fear, or racing thoughts. Physical changes may include dizziness, lightheadedness, headache, nausea, numbness, or tingling in a part of the body. During a seizure, some symptoms may include loss of awareness, often known as the blackout period of a seizure, confusion, periods of forgetfulness, memory lapse, distraction, daydreaming, loss of consciousness, unable to hear, unusual smells, including burning rubber, unusual taste, loss of vision or unable to see, and sensation changes throughout their body. Physical changes may include difficulty talking, in which case the individual may stop talking, they may stop making sense, have garbled speech, keep talking, or have speech that doesn't make sense at all. A person may be unable to swallow, experience drooling, repeated blinking of eyes. They may have lack of movement or muscle tone. They may have tremors or twitching and jerking of body parts. They may experience movements that may occur on one side of their body, their face, arms, legs, or whole body. After a person has a seizure, they may be slow to respond or not be able to respond at all, feel sleepy and confused, experience memory loss, have difficulty talking and writing, feel fuzzy, have lightheadedness, or they may become depressed, sad, upset, scared, anxious, frightened, or embarrassed. Physical changes may include injuries such as bruising, cuts, broken bones, or head injury if the individual fell during the seizure. They may experience tiredness, exhaustion, sleep for minutes or hours following an episode, have headache or pain, nausea, weakness on one side of the body, an urge to use the bathroom or lose control of bowel or bladder. There have been many different causes of seizures reported. First includes scarring, which is the most common cause of seizures. The scarring can arise from a number of different pathologies, including injury, stroke, or developmental abnormalities. Second includes tumors. A tumor may produce scarring, as with the other pathologies previously discussed, and it may put pressure on the area of the brain that can then induce seizures. The third cause, fever, is a cause of a specific type of seizure known as febrile seizures. They typically occur in children and are the brain's response to greater than normal increase in body temperature. Fourth includes withdrawal. This is typically seen in the excessive use of alcohol and drugs. These seizures can be caused by sudden loss of inhibitory effects of drugs modulated by the glutamate receptors. Genetic factors are the fourth cause of seizures. Some of the genes that have been implicated in seizure disorders are connected to ion channels which are responsible for depolarizing of cells and the generation of action potential, leading to increased firing of these neurons. therefore resulting in a seizure. In newborns, seizures may be due to brain malformations, lack of oxygen during birth, low levels of blood sugar, blood calcium, low magnesium, or other electrolyte disturbances, inborn errors in metabolism, intracranial pressure, and maternal drug use. In infants and children, seizures can be due to fever, brain tumor, infections. In children and adults, seizures may be due to congenital conditions, genetic factors, progressive brain disease, which is often rare, head trauma, and in adults and seniors, the most common cause of seizure includes stroke, Alzheimer's disease, and trauma. There are many different approaches to the management of seizure disorders. Typically, medications are the first line of intervention. However, for some intractable forms of seizure disorders, neurosurgery is necessary to alleviate the symptoms so that a person may live a normal life. Anticonvulsant medication may be used for some patients who have seizure disorders. These drugs act in a number of ways to slow down neuronal activity to prevent seizures from occurring. Some drugs are targeted at voltage-gated sodium-calcium channels to prevent depolarization across the cell membrane of a neuron in an attempt to stop an action potential from generating. Other classes of drugs modulate GABA receptor functioning. GABA is an inhibitory neurotransmitter that decreases activity in brain cells. A closely related class of drugs are GABA analogs that, instead of modulating receptor function, decrease neurotransmitters. There are other medications available to help control seizures as well. As a speech-language pathologist, we are also concerned with the treatment of seizures and communication. Hippocampal damage, which is present in approximately 50% of seizure disorder cases, can lead to difficulty with learning, memory, orientation, and spatial navigation, which may result in anomia and can affect both expressive and comprehension of language. Additionally, the treatment of seizure disorders may result in further communication issues. A temporal lobectomy in the left hemisphere may affect language centers if they are near the focal point of the seizure, or a corpus callosomy can serve in helping to sever the connection between the left and right hemispheres, preventing language centers on the left side of the brain from integrating information from the right side of the brain, including prosody, which may be important to communication. Knowing how these surgeries will affect our overall patient's outcome will be important with understanding and developing a treatment plan for our clients. A third option that individuals may consider is a ketogenic diet. A ketogenic diet is one that is high in fat and low in carbohydrates. Although the benefits of a ketogenic diet have been known for nearly a century, its mechanism of function is not. A ketogenic diet leads to the production of ketones that nourish the brain when blood glucose is low, which is necessarily true in this low carbohydrate diet. A ketogenic diet has also shown benefits in the management of symptoms of disorders like autism spectrum disorder and attention deficit hyperactivity disorder. Surgery is almost always a last resort if medication fails to control seizures in an individual. These intractable forms of seizure disorders require removal of the brain tissue or changes in the connective pathways of the brain to stop seizures or lessen their effects. Although these measures may sound extreme, there is frequently an upswing in cognitive functioning following the removal of loci of the seizures, as these areas are previously preventing adjacent areas from functioning properly. Corpus callosomy is a surgery which severs the corpus callosum, a thick band of fibers that connects the right hemisphere to the left hemisphere. It is intended to contain the seizure activity to the hemisphere in which the seizure started. This surgery can be used to manage generalized seizures which may travel well outside the area of origin. A lobectomy is a surgery which involves the removal of the brain tissue where the seizure activity originates. Typically, this is a very small area of focal tissue. It is most often used in temporal lobe epilepsy, the most common intractable form of seizure disorder seen in adults. This surgery can help manage complex and simple partial seizures that are confined in one area of the brain. When we are working with individuals with seizures or individuals who are medically compromised, we will want to make ourselves aware of the safety protocols we might want to take if we are working with them and they experience a seizure or a medical emergency. I've included just a little layout of some of those general rules that you follow when a person has a seizure. Most seizures in people with epilepsy are not medical emergencies. They end about after a minute or two without harm and usually do not require a trip to the emergency room. As we've discussed, though, generalized seizures can result in a person falling to the ground and having periods of jerking and quick movements, which may result in them becoming harmed during their seizure. If an individual hit their head or has signs of broken bones or bruising, it is important that the person goes to the emergency room to be checked out. When a person has a seizure, you will want to turn them to their left side so that the blood supply can get to their heart. Cushion under their head, remove glasses. If somebody was eating something, you'd want to make sure that they did not have anything that could get near their mouth that they could choke on. You're going to want to time the seizure to make sure that the person is having the seizure under the 2-minute mark. Make sure that they don't hit their head and give them plenty of room. Do not restrict them from thrashing or jerking. Other reasons to call an ambulance may include a seizure that lasts more than 5 minutes. If the person is not wearing a wristband that says that they have epilepsy, you'll want to call an ambulance. If they have difficulty breathing or swallowing afterwards, or if they are pregnant or have other medical diagnoses. These are just all really good rules of thumb when working with individuals who have epilepsy and things you will want to take into consideration.